people had a lot of questions and about the digestive tract, the different diseases and investigations. So in short, our GI tract processes food, and from the time it is first eaten until it is either absorbed or excreted. The major organs which we deal with in our digestive system includes a food pipe, stomach, liver, pancreas, small intestine, and colon. Okay. A few important facts, because there are some myths going around. As you grow, your organs in size increases, your stomach grows with you, but there's no actual way to shrink your stomach. All those people looking into means to weight loss, unless you have a weight loss surgery, there is no actual way to shrink your stomach. If people are advertising you to buy medicines to shrink your stomach, there is none. There's only a surgical procedure by mean which you can actually shrink your stomach. And the size of the stomach is actually not correlated with your weight, but it's more correlated with your height. So people who are overweight or who gain weight have the same kind of stomach size as people who struggle or thin. Latest science shows us that actually we have a lot of bacteria in our gut, and they actually play a very important role. The gut flora helps us not only to digest food, but it actually reduces harmful substances, and it also helps to stimulate our digestion and production of many vitamins. We are realizing more and more that this gut flora plays a very, very important role, not only in maintaining a good digestive system, but through our digestive system, it does have impacts on our other systems like a heart and immunity and so forth. And you may be seeing a surge of people, going for probiotics. I want to spend a few minutes on that. Basically, there are two things. Probiotics are basically bacteria which people have shown that are found to be useful. The actual studies which show that probiotics are only useful in certain conditions, like after taking antibiotics, or there are some digestive disorders. So people should not be blindly taking probiotics for every digestive issue. Second thing is, many of the probiotics available on the over the counter or on the shelf are basically bacteria, but there's no quality control. So we actually do not know if those probiotics which you're taking are healthy bacteria or just dead bacteria which you're ingesting. So my 2 cents on probiotics is that talk to your doctor if you really need it. Second thing is, make sure you find out that it's a good and dependable brand. There is something which can be done, is that you can actually nurture good bacteria by what you eat, and that's why it is very important to pay attention to. That's the most important thing, that a good diet leads to nurturing of good bacteria in the GI tract, and actually can obviate the need that you don't need any probiotics. I cannot stress this more, that high fiber diet plays a very important role. The more and more we are pressured for time, we are running for job, don't have time for lunch, we go grab lunch from cafeterias, more processed food which are low on fiber. So make sure you keep a high fiber diet. If you eat fruits, try to eat with the skin, legumes, vegetables. If you cannot eat high fiber diet, it's very easy to supplement that and take a fiber supplement. Usually the powder form of fiber works better than the fiber gummies or fiber candy bars. Make sure you take a lot of water when you take fiber. Also, these are general food habits, that there are foods which are high in fat are not good for you. If you want to eat meat, try to eat the lean parts, turkey, skinless poultry. As I told you about, instead of probiotics, you can actually, if you want, one of the natural probiotics is actually yogurt or kefir, and they promote the good bacteria. So there is a lot of fashion these days about gluten-free diet. A lot of people feel that, and mostly being sponsored by our Hollywood actors who see that they're on gluten-free diet and free, feel great. Now, gluten-free diet is not only very expensive, but it's a very cumbersome process. There is a very good blood test, and there is very easy to find out if you have actually gluten allergy or not. If you have gluten allergy, you definitely should avoid gluten. But most of the people actually who are out there and on gluten-free diet are not actually have gluten allergy. They may be gluten intolerant, maybe they get far more gas and feel a little more of bloating, but they're not allergic to gluten. So make sure, if you want to go on this route, talk to your doctor, get it tested, know for sure whether you have it or not. Otherwise, it's a very cumbersome lifestyle. These are also some journal habits. Make sure you eat on schedule, stay hydrated. I mean, I see a lot of people carrying jugs of water. They make it a point to drink gallons of water in a day. There is no scientific evidence to support that. I think just listen to your body. If you're thirsty, drink water. We live in Houston, it's a hot. Just make sure you stay hydrated. But there's no reason to drink gallons of water in a day or force yourself. So just listen to your body. Exercise regularly, manage stress. Okay. I'm gonna discuss briefly run about some few disorders. One thing is very common is about heartburn. Heartburn can lead to chest pain or some nausea. Severe heartburn can lead to, if acid is coming up to your mouth, can lead to tooth erosion. It can lead to some damage in the food pipe, which can cause trouble swallowing. If your heartburn symptoms are mild, you can try over-the-counter medicines such as Pepcid or Zantac. If your heartburn symptoms are more severe, then we resort to more prescription medicines, and then I would advise that you do consult with a GI physician. If you go on the internet, and you're going to find that there's a laundry list of food items which actually they will say you to avoid in reflux disease. Science has shown us that scientifically evidence-based shows us that only few food items which actually definitely worsen reflux. One of them is coffee, other one is alcohol, smoking, a lot of tomato-based food products, peppermint and dark chocolates. For the rest of the food items, there is not great evidence. So if you are suffering from reflux, if you go on internet and you find a long list, you don't have to be that restrictive in your food style. If you just avoid these 4 or 5 items or take lesser of them, you should be okay. There are good medicines to control reflux, and in severe cases or people who don't want to take medicine, there is good surgical options these days. I put this slide here because in US at this point, one of the major causes of liver problems is health supplements. There's a huge industry going on there propagating that you need to take various kind of vitamins, minerals, omega-3 acids, whatnot, to maintain your body. All of these products which are sold over the counter are not monitored by FDA. So that means whenever you're taking this health supplements, you're at the mercy of the manufacturer, and who are basically manufacturing things for a profit. None of the studies which have been sponsored by NIH, which is the highest institution of medicine in this country, has shown any benefit of these health supplements. There is a few subpopulation of people who benefit from health supplements. If you are in the reproductive age group and a female having menstrual cycles, you definitely benefit from taking an iron. If you are a female who is postmenopausal, you definitely benefit from taking a vitamin D and calcium. Other than that, one multivitamin a day, maximum of that. Other than that, there is no great evidence of taking omega-3 acids or so many other health supplements which are being sold over the market. Now, all of these health supplements have other materials in it, preservatives, such like that, and any of them can harm the liver. So that is why it is very important that you limit your health supplements and only take what is necessary. And when in doubt, do talk to your physicians about it. Now, colon is very important part of the body. Its main job is actually to absorb water. The common problems which we see with colon comes as constipation, very common problem, can be easily controlled with high fiber intake, bleeding, these pouches which form, which is known as diverticulosis. And another big problem with colon is colon cancer. But the good news is it is preventable. There are few cancers in the body which we can prevent. We know about breast cancer, cervical cancer, and colon cancer is luckily is one of those cancers which is preventable. And the most reliable test is a colonoscopy. For general people, uh, colonoscopy is recommended for all men and women at the age of 50 and above. If you have a family history of colon cancer, you should get your colonoscopy before the age of 50. There are certain conditions like colitis which merits earlier colonoscopy. Any blood in stools need investigation. This is very important. A recent study by American College Oncology showed that there is a surge in colon cancer cases, people who are younger than 50. And most of these patients actually did not pay attention to they must have some blood in stool, they never got investigated, and later on were found to have colon cancer. So any blood in stools is abnormal and needs investigation. Do check with your doctor regarding that. Just a few points just to discuss how a colonoscopy is done. For colonoscopy, we use a flexible camera which we insert from the bottom, and we go around and go to the whole colon, and we go to the end of colon. We identify that by because the small intestine joins this. We also see the opening of the appendix. Then we watch out and basically go on a polyp hunt. Polyps are these small mushroom like things which grow in the colon. They grow with age and with also with family history. These are the important determinants, and these are basically the precursors of cancer. All cancers start from here. So on the colonoscopy, we hunt for these polyps and we take out these polyps. When we remove all these polyps, we remove all these precursor lesions, and that is how we prevent colon cancer from happening. So as I told you, colonoscopy is the most effective method of preventing colon cancer, and is recommended for everybody 50 and above, and anybody who have blood in stools needs investigation. The counterpart of the colonoscopy is an upper endoscopy, in which we pass a camera through the mouth and we can look into the food pipe and in the stomach. For both these tests, you get sedation, so patients don't feel anything. Common indications to perform an upper endoscopy includes abdominal pain, patients having nausea, vomiting, difficulty swallowing. If you have long-standing reflux, you should get it at least once. Patients having unexplained weight loss, and for anemia and bleeding disorders. Both these tests can be performed at the Kelsey at the main campus, and also we have at Spring, an ambulatory surgical center. If you need it, you just need to talk to your gastroenterologist about it. I think I'm going to end my presentation, and if you have not and have doubts, please text your questions, and I'll have an opportunity to answer them. So the first question is, what is a healthy?
Yeah, so the first question is, I am a 30-year-old female. So essentially it's asking what age should colonoscopies get done? And I know Dr. Mittal covered that, but maybe you can go into a little bit more detail.
Yes. So the first question is about somebody who has a family history of colitis. If you have a family history of colitis, you do not need necessarily a colonoscopy at earlier age, until unless one of your relatives develops colon cancer. If you yourself have any symptoms of chronic diarrhea or blood in stools, then you definitely need a colonoscopy. But just for screening, a family history of colitis doesn't mean that you need an earlier colonoscopy. Second question is, do you suggest having both an upper endoscopy and colonoscopy done at the same time if you have a family history of colon cancer? The answer is no. If you have a family history of colon cancer, you just need a colonoscopy. That does not increase the risk of your cancer of the stomach, so you don't need upper endoscopy. The next question is, what is your take on colon cleansing medications or procedure? That is a very good question. It's a lot of shops out there which are selling colon cleansing as a method of good health. Actually, we have studies which document that this is harmful, and for a very simple fact that when you actually cleanse your colon, you essentially wash out your colon. It's just like washing out your colon with a hose, and with that you're washing off your good bacteria. After a good colon cleanse, actually you require a week of good food intake to repopulate all your colon with the good bacteria again. So there is no evidence. On the contrary, there is evidence to suggest that all this colon cleansing actually harms you. If you suffer from constipation, you just need some medications to have regular bowel movements, but you definitely do not benefit from any colon cleanse. Okay.
Okay, so we have another question. What damage can occur with the overuse of probiotics?
So probiotics are basically bacteria. So if you're taking a lot of probiotics and you're dumping bacteria into your GI tract, which may not be needed, so they can, if there are a lot of bacteria, they can lead to all kind of problems. They can, and if your immune system is compromised, you can also land up with infection. Second thing is, over-the-counter probiotics sometimes are dead bacteria. So basically, what you're taking may not be what you need. Most of the conditions which people take probiotics are not helpful. There are only few conditions where you really need probiotics, and one of the most important thing is if you're having a diarrhea after taking an antibiotics. History of colon cancer, and then they say that if I got a colonoscopy and I'm already it's normal, when is the interval that I go back in? That depends upon the what age was your family member who got colon cancer. If somebody got it at a young age, less than 60, and is a first degree relatives, you need to check back in 5 years. If somebody is a distant relative, and then you're good for 10 years. So somebody asked a question about hepatitis C treatment. We are in an era where there are, hepatitis C treatment is really effective. The cure rate is more than 95%. Treatment is just pills which have minimal side effects. Anybody who has, any risk factor for hepatitis C or was born in the age group of baby boomers should be checked for hepatitis C. Yeah, so somebody asked a question about Nissan fundoplication to eliminate my GERD. Is this surgery safe? Does it really work? Surgery is safe. The complication rate is low. It does work. About 10 to 20% of people after a Nissan, about 5 years, do need to go back on medications. The other thing you have to remember about a Nissan is basically what they're doing is creating a wrap so that you don't reflux. Some people cannot burp after that, and they get a lot of discomfort from this feeling that if they drink something or drink a soda, they cannot natural burp, and it causes them a lot of discomfort. So make sure you talk about these side effects which can happen after the surgery. Get this question very often, that I had polyps, what can I do, or how polyps form. As I told you, polyps, the major risk factors for polyps are, one is aging, more common in men, and family history. And there's nothing you can do about these three factors. Out of diet, we have found that more animal fat rich diet does play a small role. So if you try to limit your size of high, like a high animal fat diet, it does lead to decreased chances of colon polyp. Castor oil, is somebody asked about castor oil good for constipation? It is effective medicine for constipation, but not good for taken chronically, because this is a stimulant laxative and it leads to dependence. So you can reach a point where you will not have a bowel movement until unless you take it. If you take castor oil on a daily basis, good over-the-counter medications for constipation include either fiber or Miralax. These are two non-habit forming laxatives. No, it's okay. So somebody asked a question about
How long does a card last?
basic for before a colonoscopy. You need to take a prep to wash out the colon. Unfortunately, at this point, we don't have any other options. But now we do have some alternatives where you take only minimal amount. I mean, I'm talking about about few hundred mls. So you can go. There's some a prep on the market known as Prepopic. If you really can't take liquid, then you should look into that.
Okay, we'll probably take a few more questions. Do you want to talk about Metamucil?
Or for any other reason you want to take fiber, Metamucil is a good option. It comes in two formats. Actually, both of them work well. Is a fiber format, and then the second option is wafers. And the wafer is just like crackers, which you can eat with your coffee and juice. You can take it. And
We'll probably do like one last question right here. So we were also asked, what probiotics do you recommend while and after taking antibiotics?
So there are two good probiotic brands on the market. One is Activia yogurt, the other is Align, ALIGN. And I want to be really cautious that you should not be taking probiotics just like on a hunch. The main indication is basically if you're having diarrhea after an antibiotic.
Okay, well, thank you everyone for attending and all those great questions. You received a good, quick lesson on the importance of digestive health and what you need to look out for and certain prevention things. And we're very happy that you were able to join us and hear Dr. Mittal give this presentation. This concludes our webinar. Just as a reminder, we do have a webinar coming up at the next month. This one is going to be with Dr. Benjamin Dillon, and